my name is Makayla, and I will be covering Action Plan 1.
Hello, everyone. My name is Lucia, and I'm going to be talking about Action Plan number 2.
Hi, my name is Genevieve Cemitier, and I'm going to be speaking about Action Plan 3.
Hello, my name is Estefany Forero, and I'm going to be presenting Action Plan number 4.
Hello there, my name is Alex Ngunjoh, and I'm going to be presenting about my group's meeting with Dr. Dahlin from Give Kids a Smile.
Okay, so our group name is Team Healthcare, and the social issue that we chose to focus on is social issue number 3, which is good health and well-being. Our mission is this. Team Healthcare is dedicated to facilitating dental care and educating individuals on proper dental hygiene, specifically to underprivileged populations, both internationally and domestically. So there are a couple reasons why we chose this issue. So personally, I'm pre-PA on an anesthesiology track, and Alex is pre-dental. So that makes us both really highly interested in the social issue of health and well-being. Alex in particular was very passionate about the issue of access to dental care, not only in the US, but internationally, like I mentioned. And him sharing that information and showing us how passionate he was really sparked interest in the rest of the group, because it was really an issue that we didn't even realize was so serious. It was easy to picture this problem, this access to healthcare issue internationally, but we didn't even realize that there are people in our own backyards here in the US that are struggling to get that access to healthcare. So quickly, even though not all members of the group were pre-health students, me, even though I am a pre-health, not pre-dental, we realized that this issue is one that all members of society should be aware of and actively working towards bettering, no matter what it is that you're truly passionate about. So there are a few other reasons. Number 2 is a little more based on research. So research has shown that oral health is integral to overall health, and access to dental services is essential to promoting and maintaining good oral health. So researchers say that oral health is a window to your overall health, as poor oral hygiene can contribute to various diseases and conditions, such as cardiovascular disease, so diseases that have to do with your heart, pneumonia, and endocarditis, which I wasn't even aware that was a thing, but it is an infection of the inner lining of your heart chambers or valves, which is the endocardium, and it typically occurs when bacteria or other germs from another part of your body, such as your mouth, spread through your bloodstream and attach to certain areas in your heart. And this is a really serious and life-threatening condition. So something that people often think of as unessential, like, those routine dental cleanings that we're told to get, are actually extremely essential and can lead to really, really serious issues if not properly cared for, our teeth, and prevented. So mental health is another reason. Mental health plays a huge role in oral hygiene. So not only does unhealthy teeth cause physical pain and possibly cause these serious conditions like endocarditis, but unhealthy or smiles that aren't perfect, decaying teeth, whatever the case may be, they lead to low self-confidence, especially in teens and adults, which is never something that we want, especially in today's society. Another reason, so social, cultural, economic, structural, and geographic factors all serve as barriers to the population that would benefit the most from access to healthcare. So that's why we found it so important that this issue should be focused on, and why we chose it. The position of the American Dental Hygienists Association, the ADHA, is that oral health care is the right of all people, and dental hygienists must play a vital role in the solution to eliminate these barriers that I mentioned earlier associated with access to care. So we also agreed that dental hygiene is something, and not only dental hygiene but oral care in general, is not something that should be questioned. Everyone deserves it, and we quickly learned how important it was that everybody have access to it. So while doing this research, it really inspired and motivated us to continue to pursue this social issue and work on finding some sort of resolution or way we could contribute. So there are many vulnerable and undeserved populations in the U.S., which is, I think, something that we're all aware of. But according to statistics, groups that have the most difficulty accessing oral health care include young children, pregnant women, and other older adults. So there are external barriers, which include, costs associated with dental care, inability to obtain dental insurance, shortage and maldistribution of dentists, low rate of Medicaid provider participation, insufficient professional dental training regarding evidence-based guidelines, lack of interdisciplinary collaboration, inadequate dental safety nets, and a complex oral health system that can be difficult to navigate. But there are also something that we call internal barriers to oral health care, which are related to low oral health literacy, fear and anxiety associated with dental care, and perceptions and misconceptions about preventative oral care. So both these external and internal barriers are further, complications, and they further are complicated by problems with transportation, childcare, work release, scheduling, personal mobility, finances. There's just so many barriers and so many barriers really that are keeping people, specifically the people who need it the most, from accessing dental care. So after, doing all this research and talking it over, and, Alex sharing some experiences he's already had with nonprofits, our group realized that yes, this is something that we're all passionate about, and that we're all super motivated to continue researching and brainstorming ways we can improve and work towards fixing this social issue.
Okay, so for action plan number 2, we were required to list 5 intervention strategies using the theory of change
The following are
model.
the 2 prototypes
So the
we
first
made
intervention
to show Dr. Jeffrey
was
Dalen.
to work with nonprofit organizations in our community in order to spread the word about events that could benefit people's oral health. The inputs with this intervention will be using our knowledge of dental hygiene, our time, funds, and our social network could make this happen. We could use social media in order to create a bigger audience since we're knowledgeable on it. Also, we will be capitalizing on professionals in the dentistry field for knowledge and resources. Activities that we could do for this intervention. We thought that our group's time will be used with all the activities. We will all capitalize on using social media as a resource in order to give the public time and place for events that could help their dental health. We will also be sharing our tool in various activities in order to bring more awareness to our project and social issue, of course. Through these activities, fundraising can occur in order to cover the costs of creating the tool. The outputs. As mentioned before, working with the organizations may provide to be beneficial to our group and its mission by allowing more people to get educated and treated by their events. Outcomes. The results of this would be to bring more awareness to the organization so that they can treat and reach more patients at different locations, of course. And this will result in more people getting access to much needed dental care. What will be the impact with this? This plan will, of course, educate the public about issues related to dental care. Hopefully, this will, of course, allow the public to participate in other events that the organization hosts. Thus, this will be result in more people getting access to dental care worldwide, which is our mission. Our number 2 strategy or intervention would be work with a nonprofit organization in order to develop a tool and, of course, strategies that make identifying individuals who may need these services much easier. So the input for this, it will be using our knowledge of area, time, and social network. We will be able to develop this tool. This may be difficult since it's already hard for the nonprofit to identify which people are eligible for their program, but we may provide a new perspective to solve this problem. The activities. Our time will be used with all the activities. Our knowledge and different perspectives will also play a role in developing this tool. We may be able to reach out to other companies and see how they identify individuals based on their needs. The outputs, as mentioned before, working with the organization in order to develop a tool will make it easier for them to identify patients with, and we'll get our goal of allowing more people to get treated by them. The outcomes of this strategy. So the results of this will be made aware to the organization so they continue using this tool and help more patients with their programs. The impact will be will mean making make identifying potential patients easier for the organization, and this is done in hopes that more patients will be seen by the nonprofit. The number three strategy would be work with a nonprofit organization and FAU to make similar events to the ones above and bring them on campus. But of course, due to COVID, this strategy could be a lot more difficult. The inputs with this strategy, using our knowledge of dental hygiene, time, funds, and social network, we will be able to develop this strategy. We will have to work closely with both the nonprofit and FIU in order to make this event happen. We might have to contact larger organizations to work with it, as well as dentists and dental specialists, in order to provide the best experience for the public. Activities. So our time, of course, will be used in all the activities provided. We will have to talk to FAU to see if they will be interested in hosting an event like this. Social media is also another resource that we will use for this strategy in order to give the public time, place for the events that could help their dental health, as well as getting people to volunteer for this event. With this, we may have to talk to the Pre-Dental Society to see if they will be willing to donate their time in order to make this event happen. The outputs. Working with the organization may provide to be beneficial to our group and its mission by allowing more people to get educated and treated by their events. This event will be the most beneficial to the community in FIU or around it. The outcomes. The results of this will be made aware to the organization so that they can recreate more activities like this and get more patients at different locations. We would also let FIU know the results of this activity to see if they would like to recreate this event in the future, maybe. The impact. This plan will, of course, educate the public about issues related to dental care. Hopefully, this will allow the public to participate in other events that the organization throws. The number 4 strategy that we were thinking was creating a tool in form of a pamphlet that will make it easier to inform the public about events and actions that could benefit people's dental health. The inputs with this strategy, of course, using our knowledge of dental hygiene, the funds, and social network, we will be able to develop this strategy. Also, we will be capitalizing on professionals in the dentistry field for knowledge and resources. The activities that we were thinking would, of course, include capitalizing on using social media as a resource in order to give the public a time and place for events. We will also sharing our tool in various activities that we will be hosting in order to bring more awareness to our project and the social issue. Through these activities, fundraising can occur in order to cover the cost of either creating the tool or giving it out in around the public. The outputs, the pamphlet will be beneficial to our group and its mission since it would allow more people to get educated and treated by the events hosted by us or the nonprofit that we will be working with. The outcomes. So the results will be shared with the organization so that they can distribute the pamphlets if they like, and this will result in more patients being treated and reached by the organization. And of course, the organization will be more, people would feel more aware of the organization, the impact. So this plan will educate the public about issues related to dental care. Hopefully, this will allow the public to participate in other events that the organization is hosting. This will result in more people getting access to dental care worldwide, and which is of course our mission. And the last strategy that we were thinking is creating a skit in order to inform people about proper dental hygiene. The impulse of this, it will be while using our knowledge on dental hygiene and social network, we will be able to develop it, and we will also need to use our creativity and ability to make a short skits in order to accomplish this. The activity, so social media is one of the resources that we will use to make these skits available to the public. We will also need to think of engaging ways in which we could film our skits to make learning about dental hygiene interesting and interactive for the public to and easy to understand as well, of course. Outputs, the skits may provide to be beneficial to our group and its mission since it would allow more people to get educated and treated by their events. Outcomes, the results of this will be shared with the organization so that they can share the skit if they wish. The impact, this plan will educate the public about issues related to dental care in engaging ways. This will also allow the public to make informed decisions about their dental health that maybe they didn't know previously to watching our skit. So after reading and discussing in the group, we decided that the intervention strategy was creating a tool that will make it easier to inform the public about events that could benefit people's dental health. The tool we had in mind was a pamphlet that would allow us to inform people in different areas of the state easily. Thankfully, this tool doesn't need us to raise any money, which works to our advantage since with COVID, it's a little bit more hard, and we can also work on it at a faster pace without having to worry about the price of it. The only thing we will have to think about is if we ever wanted to print them out to give them out in the public place, but that's also not as much money that we have to raise because printing something is not as expensive, of course. And so reasons why we chose, like mentioned before, it's not it doesn't cost us a lot of money or any money. This activity also works better with our schedule since we're in college, and of course because it's mostly remote, we can work with multiple organizations and create multiple pamphlets with different information in them. Um, and of course it can reach more people easily and faster. Thank you.
So, in essence, Action Plan 3 was about us looking for 5 different nonprofits that we were interested in working with to then decide which of the 5 nonprofits we were going to be contacting and then getting closer to figure out how we can create a tool to be used for educational purposes to help people become more aware of their dental health and to provide more dental care for those who cannot, or those who do not have access to it. So the first organization that we looked at was actually Project Dentist Care. So first off, Project Dentist Care, their mission is to establish dental access programs statewide. We decided to give that particular mission a 10 out of a scale of 1 to 10, which we did have to give a scaling rate for each of the parts of each nonprofit to decide which one got the highest rate and then to decide which organization we were going to work with. Following that was their service, resources, products, and programs. So Project Dental Care provides a safety net of preventative and restorative dental care to those in greatest need. That aligned greatly with our mission for our personal group, so we decided to give that a 10 out of 10. Following that, their outcomes, which is bringing dental care to the community since 1993. Project Dental Care clinics also have provided treatment to nearly 43,000 unserved patients in Florida, which resulted them in about $14 million in donated dental care costs over the past 6 years. So that is obviously very great information, very useful information, and a great outcome for their nonprofit. We decided to give them a 10 out of 10 as well. Their Project Dental Care's finances did not receive as high of a scoring just because we can't access their IRS forms, so it doesn't really show if they're completely nonprofit, and they supported the participation in United Way, which is a one-of-a-kind program, and it's for those who need dental care the most, but they didn't really provide the free dental services to cover the basic costs, so we weren't able to get a lot of information concerning their finances. That's why they received a 1 out of 10. Human resources for Project Dental Care consisted of numerous organizations in Florida, most of which consisted of dentists who volunteer their time. So this didn't give us a lot of information about what they do. This is why they received an 8 out of 10. Their human resources department specifically just wasn't really providing much information on what we were looking for. After this, we did decide to look at their board governance and how well their board was run. They received an 8 out of 10 for this as well. It was a good score. However, it wasn't exactly what we were looking for. We were kind of looking for something who was maybe more easily accessible, the board, so that we were able to get in contact with them. Lastly is their strategic planning. They, besides providing, the basic dental care to the populations who maybe cannot access it as well, they also did assist the FDA in presenting a more complete picture of community service provided by the volunteer dentist. So this system has had really positive outcomes, and we decided to give them a 10 out of 10 as well. The second nonprofit that we were looking for was Oral Health America. Oral Health America's mission is to change lives by connecting communities with resources to drive access to care, increase health literacy, and advocate for policies that improve overall health through better oral health for all Americans. Their mission statement aligned perfectly with what our mission statement was, so we decided to give them a 10 out of 10. For their services, resources, products, and programs, they have different initiatives that impact different communities. They Smiles Across America is a program that provides prevention services to those who are uninsured or underserved. They give access to those people who can't afford it, those who don't know even how to maybe apply for different services. This basically, in all, we found a lot of very valuable information, a lot of very good information, which made us give them a 10 out of 10 for their scoring for their services. We felt that it greatly aligned with what we were looking to do personally. The outcomes for what they have done as a whole, they have distributed more than 500,000 units of donated dental products annually, and this helps with thousands and thousands of treatment plans, even from 1998. They have, through the publication of the State of Decay and Provision Guidelines for Action, Oral Health America developed a set of policy recommendations and actions based on the issues highlighted in that specific report. So they just bring awareness to thousands of people. They are looking for growing the dentistry websites, so that they reach millions of people yearly, and this is just continuing with one of the things that we were looking for our personal project, was to bring awareness and education to those people who are not aware of how important dental care is. We decided to give them a 10 out of 10 in this area. Unfortunately, we did not find any information for human resources, so they did receive a 0 out of 10. Their board governance also received a 0 out of 10 as well, since we were not able to find any information with that. And lastly, their finances, we gave them a 9 out of 10, which was better than the other two, the human resources and board governance, so we were able to find some information. The nonprofit in the year 2017 lost over $1 million. This was the Oral Health America. They received report from the foundations, corporations, and individuals who decide to donate to their projects. So we gave them a 9 out of 10 for that. Unfortunately, since we did find no information for their board governance or human resources, they did not seem like a good candidate for us to continue to seek to work with them. Number 3 was National Children's Oral Health Foundation. So their mission statement is that they increase access to oral health care by supporting nonprofit clinics and community partners delivering education, prevention, and treatment services for underserved children. They work to ensure all children can access dental care and learn about oral health. Again, 10 out of 10 for the mission statement. It aligns perfectly with what we were looking for. Following that, we wanted to look more into their services, the products, and their programs. We received a 10 out of 10. We gave them a 10 out of 10. Their efforts are focused on primarily 2 areas. First is access to care and prevention and education. They have 3 access and care programs designed to help serve underserved children and teens and to access the care that they need to be pain-free, healthy, and to be ready to learn. They also have 3 prevention and education programs designed to prevent further decay with awareness and initiatives and educational tools to help those children and families with the things to have them be able to access the care that they need. So again, a 10 out of 10 for their services and programs. The outcomes of what they have achieved as an industry. America's Tooth Fairy has received about 500,000 children and caregivers each year. Over 2 million oral care products have been distributed to kids in need across the country, and continually more than 21 million in financial support and resources have been distributed to the nonprofit dental organizations that serve these children. The outcomes speak greatly for what they can do, so we decided to give them a 10 out of 10 for their scoring as well. Finances, we were able to give them a 9 out of 10. We did find the annual report for 2015. The nonprofit lost about a little over 400,000 in money that year for 2018. The board of directors and management of America's Tooth Fairy, they're committed to upholding the highest standards of ethical conduct, financial management, and donor stewardship. They audited annually by an independent accounting firm. They gave a significant amount of information for financing, which we were grateful for and made us more confident in working with them. Human resources. Jennifer Merritt is actually one of the director of operations. Robin Van serves as a national program manager, and lastly, Jan Badger serves as the communication manager. So we gave them a 10 out of 10. We were able to find 3 different people who work under their resource team, and we were also given contact information to seek more information if we wanted to speak to them. This was really important for us. We gave them a 10 out of 10 again. The Board of Governments on their website, which is americanstoothfairy.org. Their board is listed. They have Ann Burke served as a chair. However, every other member in their position is also listed. They have 12 members in total on their board, and they're all committed to increasing access to oral health care. This was also incredibly important for us since we did want to get in contact with a nonprofit. They scored a 10 out of 10 for this area as well. Lastly, there's strategic planning. They have made a drastic impact on the community since when they started, which was back in 2006. They've cultivated a program that reached over 10 million children who all equally deserve beautiful and healthy smiles. We gave them a 10 out of 10 as well in this area. Number 4 was New Life Smile. For New Life Smile, this was actually the fourth one we wanted to look at. Their mission statement is a nonprofit organization dedicated to helping the unprivileged overcome disadvantages of a socially unacceptable smile. A 10 out of 10 as well. We believe that aligned with our mission statement. Their services, resources, products, and programs, they accomplished this by providing select applicants with access and funding to affordable, non-invasive smile makeover services. This removes a significant barrier and allows them the ability to advance their lives, personality, and to also be socially and financially more advanced. We gave them an 8 out of 10. It was a good overall explanation of their services, but it wasn't completely aligned with what we wanted to work with. Their outcomes, they find candidates with massive potential, commitment to changing their life, and that's what they do. They help those candidates with providing them with a new smile. We give that a 10 out of 10 because that is what our aim is to help those people who want to make a change to their life with giving them the step up of having a beautiful smile. Financially, they received a 1 out of 10. We were not able to find an IRS form or the annual report for the organization, and there wasn't much information at all concerning their finances. Human resources, they received a 9 out of 10. They have helped over 300,000 people and have a large group of individuals who help in having this dream be achieved. And they have partners locally serving over 3,000 clients. They received a 9 out of 10 for this. Their board governance, they work with doctors all across the cosmetic and dental industry. We decided to give them a 10 out of 10 for this as well because they are working with licensed professionals and professionals who seek to providing perfect smiles. Lastly, their strategic planning is in accordance with the financial outlook of ELBO funding. They continue with paths that communities find their local candidates and are worthy of having a smile design changed. That way, all the money being locally donated is helped with an individual from that community, making the cause more personal to the individual and to the community as a whole. They received a 9 out of 10 for this. Lastly, Give Kids a Smile, which is the organization that we decided to work with. Their mission is providing underserved children with free oral health care. It was straight to the point, extremely direct. They received a 10 out of 10 for this mission statement. It aligns perfectly with what we were looking for. Their services, resources, products, and programs. Give Kids a Smile is run by American Dental Association, one of the largest dental associations in the United States. It has 161,000 current members and approximately 650 dentists and 6,500 dentists and 300,000 dental members who volunteer at Give Kids a Smile events each year. They received a 10 out of 10 for this as well. The outcomes of Give Kids a Smile, they have provided 300,000 children yearly with free oral health care education, screening, preventative, and restorative treatments. A 10 out of 10 for this as well. The fact that they do this, yearly and are able to help that many people is just really astounding, and we were really, really interested with this. For their finances, we could find their financial report for Give Kids a Smile all the way dating back to 2018. The information from their IRS form 990 is also available dating back to 2004. And basically we just found a lot of information concerning their finances, which made us feel really confident that they were a good nonprofit organization, and it helped us feel more secure in being able to work with them. For their human resources, they received a 10 out of 10 for finances. Human resources, unfortunately, we were not able to find any information. They did receive a 0 out of 10. Their board governance, when we looked at the Give Kids a Smile National Advisory Committee, the members on their website, they have either all of them, of the majority of members are all qualified dentists or medical doctors, and it's very valuable because they'll easily be able to understand the logistics of providing free dental care on such a large scale. So they received a 10 out of 10 in board governance. And then lastly was their strategic planning. The sponsors, which Give Kids a Smile, they're mostly in the dental or healthcare field. So they're doing it for interest of support, and it also benefits their own businesses because it brings awareness to their own businesses. Basically, we just decided that Give Kids a Smile was the best nonprofit organization to work with. We found that it really appealed to the mission statement that we were trying to come across as a team, and we thought that this was going to be the most perfect one to fit with our group dynamic.
So after we decided that we wanted to work with the Give Kids a Smile program, we were on a hunt to figure out who could spare a few minutes of their time and talk to us about our tool and how the organization is handling COVID. We went on their webpage and found the contact information for Dr. Jeffrey Dalen. He is the co-founder of Give Kids a Smile. He was born and raised in St. Louis, received a Bachelor in Science degree in chemistry from Emory University, and then went on to the School of Dentistry at Indiana University. Currently, he serves as the media spokesperson for the Greater St. Louis Dental Society and chairperson for the Dental Society's Critical Issues Response Team and Communications Committee. He's won awards for his work with Give Kids a Smile from Chills Foundation, Bank of America Foundation, Focus St. Louis, and the Progressive Youth Commission. He recently also received the Maynard Hine Award from the Indiana Dental Association, Alumnus of the Year from Indiana University's School of Dentistry, and the first ever American Dental Association's Smiles Champion Outstanding Oral Health Professional Volunteer Award. Getting his contact information was the easy part, but then we had to kind of write an email that would let him know what our goal was and what we were trying to accomplish by reaching out to him. And Makayla wrote the following and sent him the email. She said, "Dear Dr. Dalen, I hope this email finds you well. My name is Makayla Fisher, and I am currently an honors student at Florida International University. For honors seminar course, I, along with 4 other group members, were tasked with finding a solution for any issue in society today that resonated with us. As pre-health students, we agreed that the access to dental care was an issue that truly needs to be addressed. Thus, we designed a tool that could benefit nonprofits like Give Kids a Smile, reach and serve more people. I am emailing you in hopes that you could spare a few minutes to talk to us about our idea via phone call, Zoom, or even email for our final part of our project. We would be honored to receive some of your thoughts and feedback on our project. I appreciate your time and consideration regarding this matter. Looking forward to hearing from you soon. Respectfully, Makayla Fisher." He replied super enthusiastically, and we scheduled a meeting with him. The day before the meeting with him, we sent out an agenda email letting him know what our names were, the talking points that we were gonna cover, and some information about our Zoom meeting, the time and the link. Even before we attended this meeting, we decided to go ahead and finish action plan number 4, or the second part of action plan number 4, which was to talk about the philanthropic resources we were going to use, the action steps in detail, and the expected milestones with target dates. Our group, as we've talked about before, wanted to create a pamphlet with the intent to inform the public about events and information that would benefit their dental health. In order to build this tool, we had to use 2 programs. We used Microsoft PowerPoint and Canvas. These 2 platforms provided us with a very interactive way of adding to each other's information. Since we can't really develop this tool together, like in person, we did it through Zoom, and using these tools, we were able to add on to each other's points. Apart from that, the programs had very creative templates for us to use, which would make the audience want to read our content and be interested in what we have to say. Apart from that, we also used our time to create the pamphlet and our creative skills to develop it. At the end of the day, we decided that one pamphlet was not enough since there's so many things that we could talk about. So we developed two. The intent, though, is not only to make two, but to continue making more and more topics that we could give to the public. One of our pamphlets focused on facts and tips that kids could use to improve their dental health, while the other pamphlet focused on activities and events that the nonprofit does that benefits the public. These two had different audiences. The first one was focused on benefiting families and children, and the second one was more targeted towards the students who would want to be involved in volunteering with this organization. Apart from the inputs that I already talked about, we also used our social network to contact Dr. Daylin, and we are also going to use our social network to distribute these pamphlets around the community and give them to as many people as possible. If we can't get these pamphlets printed with the school for free, then we would have to use our own money in order to make these pamphlets a reality. Another thing that we also talked about as a group was that we could also make a mailing list in order to distribute these pamphlets easier, since Corona is a thing and not that many people are out in the community. After we decide what prototype is best for us, we will start production. Once we have around 200 pamphlets printed, we will begin distributing them around campus and passing them along to people who would benefit with this information. We also thought about the fact that we have elementary schools nearby, so we could always give the pamphlets out there as well. We would love to have these pamphlets go out before winter break, but we didn't realize how long it would take us to develop these. So this target date is no longer an option, but I am sure that once we come back from winter break, we are going to be able to distribute the pamphlets around campus. Realistically, maybe the second week of January, we'll have them out there.
Our group originally reached out to Dr. Daylin at the end of November, proposing the idea that we meet with him. Surprisingly, he got back to us within about 10 minutes, and he said that he would be more than happy to meet up with us on a Thursday, which is actually his day off work. So we created a small agenda for that meeting, and we sent it to him by email, which Professor Shu recommended to us. So that the meeting could run smoothly. So we only intended the meeting to last for around 30 minutes, but as we didn't want to consume too much of Dr. Daylin's time, but actually it ended up lasting just over 45 minutes. So he actually had quite a lot to say to us. So me personally, I personally was blown away by how much Dr. Daylin actually had to say to us. Like, he actually has quite a big history about Give Kids a Smile, being a co-founder himself, and also I was very grateful for how open he was to give our group as much information as possible to make this project a success. So we did have a few questions in mind going into the meeting, which we were looking to be answered, and we knew that Dr. Dalen would be the perfect person for this. So when the meeting started, at the start, we all introduced ourselves, and then we asked Dr. Dalen to do the same. And then he dived into what Give Kids a Smile is and how it came to be. And as expected, he actually had quite a lot to share, and he shared quite passionately and in detail about how we had the idea of Give Kids a Smile from essentially nothing back in 2002, and now fast forwarding to today, over 5.5 million underserved children have received free oral care across the US. Fortunately, he came from a family of dentists. He shared about how his dad's a dentist and how his son is also a dentist as well. So he had quite a large network of people who were willing to help, but ultimately his biggest obstacle was being able to reach to the people, you know, at the top who could really push forward his idea to really make Give Kids a Smile a reality. So after establishing the foundation for Give Kids a Smile, Dr. Dalen shared about how hard it actually is to actually secure a large number of children to see at the Give Kids a Smile events, because there's quite a lot of politics involved in the process. So the first Give Kids a Smile event actually happens in St. Louis, which is where Dr. Dalen is from, and he shared about how it was a huge success, and 325 children received free treatment. After which, Dr. Dalen contacted the American Dental Association to encourage them to make this an event that could happen all over the country, which it now is today. And personally, I was lucky enough to volunteer at the Give Kids a Smile event this spring at Nova Southeastern University College of Dental Medicine, and it was truly amazing. Like just seeing how all the parents come in with their kids, and there's bright colors, there's decorations. The dental students are all having the time of their life, because typically being in dental school for them can be quite hard, but being able to give back to their local communities, the dental students really appreciated. Most of the kids did want to be there. Like it can be common for kids to not like the dentist, but it's really awesome how they make it a kids day for kids to come through and get free healthcare. And Dr. Dalen shared about how hundreds and thousands of dollars worth of free dental care is typically delivered at each Give Kids a Smile event across the country. And despite this, one of the main obstacles that they have to deal with is patients actually not showing up. So in anticipation of this, they actually have to overbook their schedules, so that they book more patients than they have time to fit, so that if some patients don't show up, they still have a very productive day. And Dr. Dalen also spoke about how they even considered paying parents or buying them lunch to encourage them to bring their children. Another question that we had for Dr. Dalen was would Give Kids a Smile operate any differently with the new challenge of us being in the middle of a worldwide pandemic? And he replied that Give Kids a Smile will actually continue as usual for main two reasons. The first one being that dental offices are actually one of the safest places when it comes to transmission of pathogens, which is evident as less than 1% of dentists have reported tested positive for COVID-19. And also, the second point was if Give Kids a Smile doesn't operate, they risk losing all of those children that they built up over the years, to really have that large patient pool. Because ultimately, it's a lot of hard work to actually acquire these children. So if they didn't run, they would risk losing these children, and also these children wouldn't be able to get the dental care that they would receive. So both of these were pretty concrete reasons, in my opinion, to keep things running. So our group showed our pamphlet to Dr. Dalen, explaining that we intended for it to be a way to educate parents on effective dental care practices for their children, also highlighting the importance of preventative dentistry. And Dr. Dalen did really like the concept. He liked how we took a more digital format to approach this, and something that we noticed is that their social media presence isn't amazing. You know, they're very Give Kids a Smile are very reliant on the individual locations promoting themselves, rather than Give Kids a Smile being promoted as one big idea. You know, so really seeing that, you know, we wanted to base something for Give Kids a Smile as a whole. He thought that was a really good concept. He also directed us to a 40-page manual on the American Dental Association website, which has a lot of information pertaining to oral healthcare for children, which was really useful as well when it came to our fun facts section on the pamphlet. He also likes our choice of colors as well, because it kind of matches the Give Kids a Smile logo, and yes, he also liked the logo that we put on the front as well. So one last question that we asked was, you know, how can people get involved in Give Kids a Smile if they want to during this pandemic? So Dr. Dalen gave us a phone number which anybody can reach out to, which we put on the pamphlet. So it's a number that anyone can reach out to find a Give Kids a Smile event in their area. And also he gave us the extension number of 2 employees at Give Kids a Smile who would be able to help us if we had any more queries in the future. So on the whole, this meeting was a really fascinating experience. I definitely enjoyed hearing the storytelling of Dr. Dalen. He really didn't have to, you know, take that much time out of his morning to help us, but it really showed his heart and his passion for what he does to really give his time to us that Thursday morning. So yeah, he had quite a lot to say, which he definitely did say, and even outside of our project itself, Dr. Dalen taught us a lot about philanthropy, and how with even a little, you know, amount of resources available to us, there's no limit to how widespread someone's impact can be if they have just a little grit, you know, to really go after achieving what they want to achieve. So, and what's awesome is that stemming from the inception of Give Kids a Smile, the American Dental Association actually now has an entire branch devoted to philanthropic activities, which I think is pretty cool now. Especially seeing, you know, in this class, we're seeing, you know, different ways that you know, all areas in life can have philanthropy, you know, help it grow. So in that same way, just seeing how Dr. Dalen's perseverance really allowed this to become a reality. So that essentially was everything that we discussed in the meeting with Dr. Dalen, and I hope you enjoyed our presentation.